I'm here at St. Paul's, Minnesota at the 3M Technology Center, where we've been discussing the future of dentistry using next generation digital technology. And one of the most extraordinary advances is the machining of new dental devices to replace damaged teeth or lost teeth that have been formed as a result of a continuous video image. Let me explain. You put a camera inside the mouth. The camera takes a video as you move the camera around, and those images are automatically converted into a three-dimensional structure which you can move around virtually on the screen, so that you can see each tooth in relation to the other teeth. You can see where the gaps are, you can see where the gums are, you can see how the upper and the lower jaws fit together, or how they don't. And out of this three-dimensional image can be built a replacement structure for an individual tooth or a bridge or whatever. And so within a few minutes of those images being finished, a file can be sent to another part of the world or to a specialist laboratory in the next town or city, and that can then be used to engineer the structure which will go into that person's mouth. It saves all kinds of intermediary steps, a lot of cost and so on. It also saves a rather unpleasant process of making a traditional mold inside someone's mouth, which many patients don't like at all. It's just one example of the way in which digital technology is enhancing dentistry, but it doesn't stop there. And it's because it's in parallel with other advances, in particular nanotechnology built into composites. Now, what do I mean by that? In the olden days, you could cast a tooth out of porcelain or some other kind of structure and hope for the best. But these teeth would not look particularly natural because they didn't necessarily reproduce the exact colouring of the tooth. You could see the join where the tooth was bonded to a piece that's been put on where the tooth had been broken. The translucency was not the same, and so on. With new materials, new composite materials, dentists are able to build up in layers replacement chunks of a tissue, of a tooth which has just snapped, or other kinds of teeth replacements. And the results are truly astonishing. An almost perfect match in terms of translucency, colouring, texture, a very hard-wearing surface which is very unlikely to break. It can be polished, and so on. And these kinds of structures are revolutionizing cosmetic dentistry, where caps, crowns, and goodness knows what have been the name of the day in the past and have really been comparatively crude. So watch this space for all kinds of innovation. And these techniques are also enabling less experienced dentists to have an almost perfect result.